Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Good morning, Stacy.
Good morning, Dr. Swain. How are you?
I'm good. We're going to talk today about antibiotics.
Well, I hear a lot about antibiotics, so I'd love to hear your perspective.
So antibiotics are great. Obviously, it's a necessary part of practicing medicine. How many people do you know have sinus infections, ear infections, throat infections, or have been admitted to the hospital for an infection and need antibiotics? And so I guess really the question is what is an antibiotic?
Yeah.
What are we giving people?
I don't think I've ever known that, and I've probably been taking antibiotics for 30 years.
Right. Well, in its simplest form, really, an antibiotic is a chemical that we use to kill bacteria. We use some antibiotics that they have different properties, obviously, for killing different types of bacteria for different types of infections. And some antibiotics actually have anti-inflammatory properties.
I didn't know that.
Yeah, we were talking before, and we were talking all this stuff about when you use an antibiotic and what you're trying to kill. Sometimes we use antibiotics because they have a specific biochemical pathway that we use to decrease inflammation.
Okay.
We do that with nasal polyps sometimes. But for the most part, we use antibiotics to kill bacteria.
So how many antibiotics are there? Because I can tell you I know penicillin and Z-Pak.
Right.
And that's what I know. So, but there's more than those, I assume.
There are a lot of them. You're right. But the easiest way to think about antibiotics is in terms of different categories.
Okay.
So there are penicillin-based antibiotics, and there are lots of those. And then there are cephalosporin antibiotics. There are lots of those. And then there are fluoroquinolone antibiotics, and there are lots of those. And so we have antibiotics that are classified into what they do. And then in terms of those families, there are lots of different individual drugs in those families. And obviously, new drugs are being developed. We haven't had a lot of new antibiotics in some time. I mean, they're still in production. They're still being developed. It's hard to get an antibiotic to the market.
Really?
Yeah, there's a lot of the Food and Drug Administration is really vigilant about making sure that there's not an antibiotic that has side effects that need to be monitored or observed, and they just need to make sure the drug is safe.
Right, like a lot of folks are allergic to penicillin, which takes out a whole class of antibiotics.
Right,
So
exactly.
what types of reactions do people have?
It can vary. You get hives when you take penicillin. I've gotten hives taking Bactrim, which is a sulfur drug. And those are pretty benign reactions. Sometimes people can get severe reactions where they even can have their skin start peeling off or have trouble breathing or have the swelling of their throat or their mouth or their tongue. And so those are obviously the more severe reactions, but it can vary. Some people have GI side effects to it. This is a great point you bring up because sometimes people will come in and say, I'm allergic to penicillin, for example, and then you start asking, well, what kind of reaction did you have? And he said, well, it makes my stomach upset or it makes me nauseated. That's not an allergic reaction.
No?
No, for the most part. We're looking in one of the common side effects of just taking antibiotics is to have your stomach upset sometimes or get a little bit nauseated. That's just a side effect of taking the medication. In general. And there are things you can do to try to minimize that. The big thing is, for the most part, we tell people don't take an antibiotic on an empty stomach. You always want to take it with food to kind of buffer the GI side effects with it. But so those are some of the things that we tell people.
So that, I think, leads us to the question of how do antibiotics work? So they're working in the stomach, right, in the GI system. Is that essentially where it starts because you ingest it? Right.
You ingest it, and that's where it's absorbed. And then they have different chemicals and different pathways that they work, which is sometimes it gets kind of complicated. But basically, this chemical that you're taking goes and attacks the bacteria, and it does so in different ways. It can kill the bacteria. There are bactericidal antibiotics where it kills the bacteria, and there are bacteriostatic antibiotics that kind of prevent the bacteria from growing. And depending on the situation, you would use a different kind of drug. The other thing that I think people ask is okay, you have a sinus infection and we're going to put you on an antibiotic. Well, how do we know what to use?
Yeah, how do you know which one to use out of all of them?
Right. So sometimes you don't, but typically we know that sinus infections or ear infections are caused from the three most common types of bacteria for those. It's usually strep pneumonia, Moraxella catarrhalis, and Haemophilus influenza. And so when you have some idea of, okay, you've got a sinus infection, these are the things that most commonly looking for. We know if you have a urinary tract infection, we're thinking of a different type of bacteria. And so we know from microbiology and biochemistry and pharmacology what kind of drug to kind of pick. Now, occasionally, sometimes, if we gave you those drugs and you're not getting better, we think, well, maybe there's a resistant bacteria. And so a lot of times the doctor may culture it. Like if you've ever had a urinary tract infection, the doctor will want you to take a urine specimen to see if they can grow a bacteria. Or if you're seeing me and your ear's draining, we're going to take a swab of the drainage coming out of the ear, especially if you've had tubes put in, to see, is this some type of resistant bacteria? Do we need to alter our antibiotic selection on the basis of a scientific, identification of what's coming out of the ear or the nose or the throat or whatever? That is usually very helpful. But sometimes when people are really sick, you're not going to wait 4 or 5 days until you get a lab report back before you initiate treatment. So sometimes we'll have to tell people, okay, we're going to start an antibiotic. We're going to wait for the culture report to come back, and we may change your antibiotic depending on what this culture shows.
Right.
And sometimes the cultures don't show anything, and then it comes a little bit of a harder situation to try to figure out, okay, do I have you on the right medicine or not?
So this leads us to the conversation of, is there too much antibiotics? And that's, I think, part of the conversation in the world today of, do we too easily give antibiotics, or is there such a thing as taking too much antibiotics?
Yeah. We were talking beforehand. I would name the show Too Antibiotic or Not Too Antibiotic because that is the question that doctors face all day long. Because you have somebody that comes in who's sick and we're trying to figure out, okay, is this a viral process or is this something I need to start initiating antibiotic therapy for? There is probably, if we're being blunt, there is probably too much antibiotics being prescribed globally by all physicians. I know I have done that, not intentionally, but it's one of those things that sometimes you think, okay, if I'm going to err, I'm going to err on giving this person an antibiotic because I don't want them to get sicker. If you're the patient and you're sick and you have a sore throat and you think, golly, the last time I had this was horrible. I was sick for a month. I don't want to be sick like that again. I want an antibiotic so I don't get that sick.
Just in case, right?
Right, just in case. And sometimes that's a good thing, and sometimes that's a bad thing. The other thing that we see sometimes is people don't take all their antibiotics. If they're prescribed 10 days of antibiotics, they'll take 5 and start feeling better and thinking, okay, I don't need this anymore, and so they save it.
Like you said earlier, there's sort of the phase 1, phase 2, there's a multi-phase potential solution using antibiotics. Is there a point at which you wouldn't prescribe antibiotics?
Yeah, it's a judgment call sometimes when you use it. Viral illnesses will not respond to antibiotic treatment. If you have a viral illness, like you had mononucleosis, let's say, you can use all the antibiotics in the world. It's not going to affect the mononucleosis. It's a viral illness. It's Epstein-Barr virus. The hard part about all this is usually when you have a sinus infection, it doesn't start with bacteria just jumping in your sinus. It starts with a cold. It starts with a viral illness. And then you get swelling and mucosal thickening and stasis of the secretions, and the little sinus cavity in there closes off. And then you start getting the yellow discharge and the pain in your teeth and the purulent drainage. And that's when you know you've got a sinus infection, and that's when you need an antibiotic. It's hard sometimes to look at somebody and go, okay, I know you feel terrible, but this is a cold, this is a viral illness, take some Motrin and Tylenol, and oh, by the way, in a week, you're either going to get over this or you're not, and then we're going to start antibiotics then. It really is difficult. Sometimes we'll do things to try to check and make sure that we don't need to start an antibiotic. If your white blood cell count is real high, that's a kind of a sign that you're having a bacterial infection. Obviously, the cultures that we were talking about earlier in the show, if you have a culture that shows this particular bacteria, we're going to start an antibiotic. Sometimes when people have a cold, you're trying to wait for the 7 to 10 days before you start an antibiotic, and they're really getting worse. They're really getting worse. You'd probably start an antibiotic in that situation. And a lot of people, it makes sense to think, okay, well, I don't want to get worse. I'm going to start an antibiotic now. That's reasonable thinking, but sometimes that is not necessarily the best thing to do in terms of trying to use antibiotics appropriately and ultimately keep that person safe, because you don't want to be on so many antibiotics that they don't work when you need them.
Right. Well, let's end with maybe some advice you have for folks out there, things to consider when they aren't feeling well or they may be presented with antibiotics. Are there questions they should ask their doctor to understand the different types of bacteria and the different types of antibiotics?
Sure. I think the biggest thing is the history. If you haven't had strep throat 5 times, and you have a sore throat, I don't know that you'd go start wanting an antibiotic right then. If you've got that history where you've had all these problems, you're going to be a little more gun shy about not starting an antibiotic because of that history there. There are more and more people that are learning about or looking online about the side effects of antibiotics and not wanting to use antibiotics inappropriately. And so sometimes when you talk to families and you listen to them, they're like, look, we've had fever for 2 or 3 days. It's not getting better. And so they're very much more educated about, when they want to start an antibiotic and when they don't. And some people really don't want to be on an antibiotic. If you say, look, I'm really okay. I think I'm going to get over this. You can try to talk them through this without having to start an antibiotic.
So generally, you would recommend trying not to start antibiotics if you don't have to?
Depending on what's going on, the history is everything.
Okay.
Obviously, there are people with immune system issues, or if they've had transplants, and there are some situations where, you would start an antibiotic early. But for the majority of people, if you've got a garden variety, run-of-the-mill upper respiratory tract infection, to try to get those people to use the over-the-counter medicines initially for the first 24, 48, 72 hours and kind of see what's going on with them. And obviously, every situation is different, and there's nothing like examining someone and getting their history. There's not I guess the better way to say it is there's not a one-size-fits-all approach for this.
Right. So for those who are suffering with a cold and they start to feel the pain, as you said, in the teeth, and they're starting to feel swollen, that's when they need to give your office a call.
Probably so. It's one of those things where if you're having those kinds of symptoms after you've had the start of a cold, assuming that you're going to be getting a sinus infection with those symptoms.
Well, thanks for explaining antibiotics today. I feel like I know so much more now. Why don't you tell everybody how they can make an appointment with you?
It's really easy to get an appointment to see me. If you would call and speak to my nurses, the direct line is 251-470-8823. Again, that number is 251-470-8823. If you call that number directly, my nurses can help you get set up to have an appointment to see me. And of course, we have appointments on the website. It's drronswain.com. That's DRRON Swain, SWAN.com for appointments as well.
Great. Thank you.
Thank you.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.